Quite often we think of menopause as hot flushes, sweating, and then the end point where the periods stop and a woman hasn't had a period for a year, leading to menopause. But what we don't talk about is the declining levels of female sex hormones, so the estrogen, progesterone, and the testosterone, which starts to decline much, much earlier than that. And your body and the brain starts to feel those changes. So that can come up quite quickly and abruptly. But that's the bit that we don't focus on. We tend to think of it as a physical change only that the body is going through, which isn't correct. The key thing really is that the female sex hormones, the estrogen, progesterone, and the testosterone levels are starting to decline, but they're not declining in a steady way. They're fluctuating, and then there's a gradual decline in that perimenopause phase. Now, the hormones will affect every system in our body, and in particular, if you're thinking about the psychological aspects of it, it's the impact that these declining levels of female sex hormones have on the feel-good hormones and the chemicals in the brain. So effectively, your brain chemistry is being altered, and a lot is happening on a biochemical level from a physical standpoint too, which is then leading to a combination of all these symptoms. The menopause will be the end point, but the symptoms are starting way earlier than that. So typically, one would be thinking about mid-40s or early 40s, but it can also start in some women much earlier than that, so late 30s. And that entire period of the run-up to menopause, the perimenopause, is a time of great upheaval where different women can experience a set of different physical or physical symptoms, but also psychological symptoms alongside. If you have no past psychiatric history, it may be that there's depression that just creeps in. There's a sense of sadness, so you may find that you are feeling more teary than usual. There can also be irritability, there can be anger, there can be real rage that some women can experience for no apparent reason. There can be a lot of negative thinking, negative thoughts, and in some extreme cases, there can even be suicidal thoughts linked to all these hormonal changes. Brain fog is an interesting one. There can be a lot of forgetfulness, word finding difficulty. Things that you found easy earlier can make you feel quite overwhelmed. And there can be a sense of, I'm not myself, or what is wrong with me, I'm falling apart or I'm unraveling. And that can be all the psychological side and results of the hormonal decline. On top of this, you've also got the physical manifestations. So some of the very debilitating ones are palpitations. So especially when you're going to bed at night and your heart's going really fast, that can be quite scary. A lot of hot flushes, excessive sweating, hair and skin changes, so a lot of dryness. Insomnia is another big one. So if you've got all these mood changes and you're unable to sleep well, then that can also feed into, again, the worry about what's happening to me. Now, the key thing to remember is all different women will have a different combination of these symptoms, which also makes it quite tricky. And all of these symptoms will also fluctuate because the hormone levels are fluctuating. So you've got this very unusual complex presentation, which will affect every single woman in a different way. When I look back over the last decade, if a woman in her 40s came to me and was talking about anxiety or depression for the first time, then I would be the one leading the conversation to say, well, have we thought about perimenopause here? But what's changed now is that there's a lot more awareness about it. So women are doing their research, coming up to me and wanting that reassurance to say, is this perimenopause? Could this be a hormonal link to it? And then can you help me navigate this transition in life? So a lot has changed positively. Women are feeling a lot more heard. It's quite a positive phase for women's mental health, which is quite exciting. We are beginning to understand the changes that are happening in the body and the mind. And we're not thinking of it as an aging process or something that the women just have to suffer through, which is great. This is $1 million question, and I think this is what happens when women come to me. They're unsure what is happening with me. There are different symptoms, and some of this stuff hasn't happened to them before. So the clue really will be, in some cases, in some women, that you've had no past psychiatric history, and now you're in middle age, and suddenly you're starting to feel depressed or anxious, or you're having thoughts where you're not feeling like yourself, or it's quite a negative thinking or the brain fog. So that makes us start thinking about hormones as an underlying cause. In some cases, if you already have had a past mental health condition or a disorder, then you can feel that these symptoms are coming back, becoming more frequent or more intense, for example. And some conditions like bipolar disorder or borderline personality disorder, you can have a period of instability after a period of stability and a good treatment plan. So in a number of ways, you can have fresh symptoms that you've never had before, or you can have instability or worsening of the symptoms or a condition you've had before. You have to bring the focus to yourself. Whilst this is a period of biochemical changes and hormonal changes happening in the body, and your body is going through this transition, sometimes over a decade, It's also a time to be reflecting on what's happening in your life in general. So a lot of women might be having, say, small children, there's stress of exams, other things happening with them. There may be work-related stress, they may be taking on senior roles. So it's a real important time in life where you have to take a step back and think about, how can I reduce my levels of stress, first of all? Could you possibly be working from home? Could you give yourself a bit of a breathing space by taking a break in the middle of the week, for example? Are there marital issues at home that need working through? Are there past traumas that need to be resolved? So all of that needs to be addressed first and foremost. And then, of course, it's thinking about how do we navigate what is happening in terms of these physical changes in the body. So thinking about, could there be hormone replacement therapy for it? Could there be specific therapies that we talked about? And last but not the least, you have to think about lifestyle changes, cutting back on alcohol, making sure you're not having processed food, but just healthy things that address micronutrients in the nutrition. And let's not forget sleep. I think that goes out the window when you've got a busy household. That's the first thing. So really protecting your sleep, making sure that you are looking at sleep hygiene techniques. So not having coffees or teas after 6 o'clock, making sure you're not taking your phone or your tablet to bed. All those things have to be done together. The basics of self-care, but really thinking about what needs to be resolved from the past and resolving some of the anxieties that you may have about the future. All of that. In terms of the biochemical changes and the hormonal changes that are happening, the most obvious one is hormone replacement therapy. Now, there are some women that will choose not to have that, and that's okay if they're able to cope with the symptoms. And it may be that you just require some lifestyle changes that we talked about earlier, focusing on nutrition, exercise, sleep, and cutting back on alcohol. But for some other women, their symptoms might be quite severe. So we need to think about hormone replacement therapy. And we also sometimes, in some cases, have to use antidepressants to be able to make sure that there is a lift to a person's mood as well as a reduction in the anxiety levels. So you can use HRT in combination with antidepressants or anti-anxiety medication. Last but not the least, what will keep you well would be obviously therapy. So as I said earlier, if there are unresolved issues from the past, we can address that in therapy, but we can also give you a safe space to think about the changes that you might be navigating in your life. So say, for example, career, work-related problems, etc. That can also be addressed in therapy. So all of this in combination will be what's necessary for a tailored approach to each individual. So a lot of women will navigate this transition reasonably well. They'll be able to cope with the symptoms. But if this is having an impact on your work and your personal relationships, the mood symptoms are incredibly prominent, and it's something that you can't shake off and it's quite persistent, then you may start thinking about wanting to get help for yourself. There are also some red flags, feeling hopeless with the situation. If you're withdrawing from work and from other people, or you're starting to have suicidal thoughts, then you really need to seek help urgently.